Hello, everybody, and welcome to this week's episode of Jump In with Jumi. I'm your host, Jumi, and each week here on blackdoctor.org, I am bringing you lively and engaging conversations about health and wellness topics that impact our community. And this week, I'm back at it again. I'm bringing you a conversation about a topic that is incredibly important, and that is anxiety and depression. Did you all know that anxiety is the most common mental health disorder in the United States, and it impacts African Americans at a higher rate than any other group, especially African American women? When it comes to mental health disorders in general, African Americans are 20% more likely to suffer from mental health disorders than any other group as well. We know that 2020 was a rough year. 2021 has been a little bumpy as well. And all the things that were going on throughout the year have undoubtedly impacted our mental health and all the things that we've been experiencing, which is why today's topic and conversation is so important. It is so necessary for us to really unpack what's been going on, but also get some sound advice from people that can help us. So today, you're going to hear from a psychiatrist and a psychologist about what we can do to effectively manage our anxiety and depression. Because this episode is so important, I want you all to do me a favor right now. Like this broadcast, but more importantly, share it. Make sure you share this broadcast with everybody because I want everybody around you to know how they can effectively manage anything that they're going through when it comes to anxiety and depression. I also want you to leave this episode feeling empowered and educated about how to effectively manage your anxiety and depression. So if you have any questions, please go ahead and put that in the chat as well. Let me know where you're tuning in from. And once again, make sure to like and share this episode. So as you're thinking about questions to ask our guests, I have a question for you all. I want to know what you all think about anxiety, knowing that it is the most common mental health disorder in the US and it affects us more than any other group. Here's my question of the week. Is all anxiety bad anxiety? Or is some level of anxiety actually healthy? What do you all think? Put in the chat, let me know. Is all anxiety bad anxiety? Or is some level of anxiety actually healthy? Once you let me know that, make sure again to share this broadcast. Let everybody know that you're watching it. Hit that share button here on Facebook. Copy and paste that link on YouTube. Because you know what time it is, y'all? It's time to introduce our first guest. Dr. Danielle Harrison is a double board certified practicing psychiatrist and residency program director at Howard University, specializing in consultation liaison psychiatry. She is a mental health advocate, and her interests include minority mental health, cultural psychiatry, HIV psychiatry, and collaborative care. In 2020, Dr. Harrison was named the Hero of the Year at the annual Women in White Coat Heroes event, which honors women in medicine showing dedication towards making their respective fields better. She has had the opportunity to speak nationally and internationally about the impact of racial trauma and culture on mental health, and has also been a contributing author on the recently published book, Racism in Psychiatry, Contemporary Issues and Interventions. Please join me in welcoming Dr. Danielle Harrison.
Hello. Hi, Jumi. How are you?
I'm good. How are you? Thank you so much for joining us.
Well, thank you for having me.
I feel like you're the perfect person to talk about depression in the Black community because of your work and because of everything you're doing. So could you give us a little background about what you do in your day-to-day when it comes to minority health when it comes to minority health and mental health?
So I work at Howard University in Washington, D.C., for those of you who don't know, but I see people checking in from North Carolina, from Silver Spring up the street. So predominantly, we serve an underserved patient population here at Howard, and that is a predominantly Black or Latinx patient population. So when I'm seeing patients, we are dealing with, of course, the same issues that everyone deals with as far as anxiety, depression, bipolar disorder, schizophrenia, and all significant mental illnesses, but we also really discuss the impact of racism, of race, culture, and social determinants of health to really address issues and help our patients on a more holistic approach. So looking at people's lives on a total approach of what's happening and really understanding more than just the patient that you see in front of you for those few minutes, like what's impacting their total lives and how we can try to approach this on a factorial level.
Okay, so let's jump right into our topic today, which is depression and anxiety. And so I want to start with depression. What is it? How is it defined? And, what are some common signs of depression?
Okay, Jumi, we're jumping in with some serious topics.
Right
we're going early with the serious topics. So depression, what we call clinical depression or major depressive disorder, which can have various levels. It can be severe, mild, moderate, but depression is a collection of symptoms, which includes things like sleep difficulties, low mood, which you might think of as sadness, but also other things are involved, like decreased concentration, feelings of guilt, feeling bad about yourself, even to the point of feeling suicidal for some of our patients. So depression is more than just feeling sad. It's more than just low mood. It's really something that's impacting your life and causing you to not really feel like you can go on, and disrupting your goals, disrupting everything from sleeping to eating to even issues like reproduction.
Oh. So you touched on something that I wanted to kind of build on, because I feel like some people say, oh, I'm just sad or I'm depressed. What is actually the difference between sadness and depression?
So sadness, anyone can feel sad. In general, most people feel sad at some point in their lives. In 2020, you might feel more sad. In 2021, you might feel even more sad than you have in other periods of time. But when we talk about depression and when it's time to get treatment, when it's time to talk to someone, we're talking about something that's impacting many parts of your life for a specific time period. So once it gets to above 2 weeks, going on for weeks and months, and you're really not able to get through your day to day, you're not able to get things done at work, with your family, with your friends, it really changes. That's when we say this is more than just sadness or low mood. So the symptoms that we look for are a little bit different across cultures. So yes, low mood is important. Difficulty sleeping is important. Feelings of guilt are important, things like that. However, some things that we look for, particularly in marginalized and minoritized groups like Black and Latinx populations, is we look for somatic symptoms. So when we say somatic symptoms, these are like body symptoms, things that you feel. And that is, for example, saying I'm feeling tired all the time. I'm feeling fatigued. I'm not feeling like myself. I just don't want to do this. Or I feel like I can't get up. I feel like I'm dizzy. I'm tired. So frequently we hear people in the Black community give these physical complaints, because for so long there's been a stigma about really admitting that you're having a challenge with your mental health, instead of talking about, oh, I feel depressed, I feel down. You're more likely to voice this in a physical symptom because that's what's more readily acceptable in general society and our culture.
So what happens what are some things that can happen if we continue to kind of deny these feelings of depression, like deny depression? Like what happens in our bodies? What happens just like in general if we don't really handle it?
Anything and everything. And I'm being very general here, and I'll give you some more specific examples, but depression can affect you just like any other physical disorder. Mental health is physical health. It's all tied in together. So when you're depressed and you don't address these things, like one that's really common and really important for us to address is lack of sleep. And when you don't get enough sleep, what can happen? You can become irritable. You can have headaches. You can have issues with your digestion. You can have issues with your menstrual cycle. All these types of things can be affected by stress, by depression. So when we say, oh, I'm just feeling down or I'm feeling depressed, you're talking about your whole body that's involved here. So everything literally from top to bottom can be affected. A lot of people experience things like muscle aches when they're depressed as well, cramping, things like that. There's a lot of comorbidity with something called fibromyalgia. So when we're talking about depression, we're not just talking about what's happening up here in your mind. We're talking about a full body experience. Heart racing, palpitations, things like that can also happen in depression. Not eating enough, overeating. It really depends on how you process your depression. So when I say anything, I mean anything can be affected by depression, also anxiety.
So that is so important to realize that there's so much that can go on and go wrong with our bodies if we continue to deny that. So when it comes to treating depression, so once we've acknowledged that depression is an issue, what are some treatments for it? And I know that there's people that are like, I don't want to take medications. I just want to do this naturally. So can you talk to us about both what medications are there, but what are some just things that we can do naturally to help improve our depression?
Right, Jumi. So I obviously am a psychiatrist. So I'm an MD. I went to medical school. I prescribe medications. I went through residency treating people. And currently still treat people with things like what goes hand in hand, diabetes, hypertension, all things with depression. So I am an advocate for using medication if you need it. So actually, if you took inventory of my current patient population, many of them do receive medication from me, but actually some of them don't. And we use different approaches, like things like coping skills, using therapy, sleeping techniques, a lot of sleep hygiene I've been doing for the last year because of just the stress that this pandemic has brought on, the just overt racism that we're seeing, the trauma, the racial trauma that's really in our faces at the forefront, which we know is nothing new since Emmett Till and beyond, but issues like Breonna Taylor, the killing of Breonna Taylor, Ahmaud Arbery, George Floyd, things like that are just in your face. We're really talking about how to give yourself a break from trauma, how to protect yourself if something is traumatizing to you. So sometimes you need medication. Sometimes you can take something more natural for your sleep, like melatonin, if that helps you. That is something over the counter, something natural, and something that I find that our community doesn't have an issue with. But again, medication is needed and there shouldn't be so much stigma about it. There's not stigma if you take your blood pressure medication, right? That's encouraged. Your kids, your family, your partners are like, make sure you take your blood pressure medication. You need to. We should be on the same level with make sure you take your anxiety or depression medication if you need to. So that's really something that our community has to work on accepting. But the reason for this stigma goes back far, far for many years.
Well, okay. So what can we do now, though, because it is so important? Like, how can our community begin to embrace taking the medications? How can it get to the level of, yes, take your blood pressure medication. Yes, take your antidepressants. How do we get to that comfort level?
I think we just have to move forward with that. And it has to be really not only accepted by Black people, but it has to be accepted by non-blackdoctor.org. It has to be accepted by these other doctors as well. Like Black people do deserve the same level of treatment. You need to offer people the same level of treatment. And 9 times out of 10, the answer is going to be medication plus therapy. So that's really how you can get through things, because I say no amount of medication is going to change whether or not you have stable housing or stable food, if you have food security, if you have job security, things like that. So really trying to mitigate these differences. And that's why I said in the beginning, I really believe in a holistic approach that includes a whole treatment team, that includes things from social workers who can help with housing, with rent assistance, with home care. I work in a system that's very helpful. Like if you can't get to your appointment, we're going to call you a lift. Like we're going to figure out a way to help you, and that all your care is centered in one place. So I'm not in a standalone psychiatric practice. I'm in a place where your primary care doctor is here, your caseworker is here, as well as your psychiatrist and therapist. Really understanding that you need to meet people where they are. And having 5 and 7 appointments in a week is not conducive for many people. But it can't just be people who look like me, doctors who look like me, who understand these social determinants and the needs of the Black and Latinx and other BIPOC communities. So everyone on a national level has to accept this and has to work together to support the Black community. And we have to, I know I said a lot, but we also have to advocate. I spent a lot of time this week talking to one of my patients about trying to advocate for appropriate healthcare services for her mother, and advocating for yourself, demanding the level of care that you see for others is very important.
So we're definitely going to touch on that because I think that is incredibly important. So before we do that, though, how does somebody go about finding the right physician for them? Like what should they look out for? What is a red flag? What is a, yes, this person works for me? Talk to us about our community finding comfort in somebody who is maybe looks like you or who doesn't. Like what should they look out for?
Well, Jumi, again, you're coming with good questions. So I would love to say, yes, please find a doctor who looks like me or tries to look like me. But the truth is the numbers just aren't out there. So fewer than 5% of therapists and psychologists are Black or African American, and fewer than 3% of psychiatrists are in my field or specialty. So it can't be upon us all like we all do. Even I now have a waiting list, like people calling Hayward and saying like, I need to see Dr. Hairston, you need to make it happen. And it's just only one me. So, we are working on really making a more diverse psychiatric workforce, which really means that across the country, these universities have to work on recruiting more Black medical students, no exception, which we did really well. Let me just say that for this year, increasing diversity in the match. We'll find out tomorrow. But for those who are not Black, or those who still care about providing care to our communities, they need to make that known. Like if you are an advocate, let people know that. If you are interested in cultural appreciation and humility, put that out there, that this is something that you do. And don't just say it. Be trained in it. Be trained in it. Like learn about it. Physicians, therapists, psychologists, we all have all these degrees on. You said I had all these certifications and boards. Yes, so people know how to do things. Right. Read and make sure you're informed to understand what's been happening historically for the Black community. And how do you find one?
Yeah.
That's a little bit more of a challenging question.
What are like a few things that they should look out for? Is it somebody that, is very well versed in all the different latest medications and therapies? Is it somebody who does a combination of talk therapy plus medication management? Like what are some things that they should say? They should tick off their boxes. For anybody that's like tuning in, that's like, what, I do want to think about having a psychiatrist in the coming weeks or so.
Well, we all, have our specific subspecialties and interests. So I can't say, make sure you go to the one who's done all the psychopharm and things like that. But really, there are websites that are helpful. Therapy for Black Girls is one. Even Psychology Today. Psychology Today I actually like because it has psychiatrists and it also has therapists, and you can find them in your area. You can find out quickly who takes insurance. You can find out who is cash pay. And shout out to all of us who do cash pay, not me. But some people need sliding scale. Some people need some help with these cash pay. But so Psychology Today I like because you actually get to see a picture of the therapist or the psychiatrist, and you can see what their specialties are, like if they work with the young adult patient population, if they work with seniors, things like that. So those are good ways to start. Also, if you have the privilege, because having insurance is a privilege, especially we learned that in 2020, a good place to start is with your insurance company. They have to provide you with behavioral health or mental health services. You can call them and say, because literally I get emails from insurance companies who say, hello, my client is looking out for a Black psychiatrist. Are you accepting patients? Make them do the work for you. You pay out of your paycheck insurance. Tell them to help you to get help.
So y'all hear that? If you have insurance, like make sure you put your insurance people to work because they can help you find that physician that you're looking for. Like they're out there and they're doing it. And I think that's so important that you bring that up because we don't know, like that's another way to advocate for yourself. It's like not just thinking that it's not available, but to say, this is what I want. I'm paying you, do this, help me find this. That's incredibly important. One thing I did want to touch on before we bring on Dr. Neil Barnett to talk more about anxiety is when it comes to this pandemic that we're currently in, are there certain things that have brought up depression, feelings of depression? Are there things that will go away once the pandemic begins to really subside, or are there lasting effects of this that we might experience?
Okay, Again, Jumi. All right, here we go. So this is definitely something that we need to look at and research as medical and mental health professionals, really to understand the trends and what's going to be happening. There are things that I saw in the beginning of the pandemic. Unfortunately, I saw an increase in suicide attempts, more suicidal thoughts, a lot of isolation and isolative behavior. Unfortunately, just because of the nature of the pandemic, you have to be safe. You miss your family, but you don't want to be near them. Those of us who were trying to social distance, well, physically distance, you don't have to social distance because you can be socially connected. So it'll be interesting to see what's going to happen. Hopefully, though, the coping skills that people found and used to get them through this pandemic, they will use forever, and those will have long-lasting effects. A lot of us have said, a lot of the Black psychiatrists that I know, and also therapists have said, like, we have gotten an increase in the amount of patients that we've had. I used to have no-show rates, no longer. Like, my patients are here, all their appointments virtually. They're like, "Hello, are you ready?" I'm like, "Okay." Because I couldn't find you for 6 months, but here you are, you're back.
Right.
Okay, so I hope that the isolative behaviors, the feeling isolated, feeling alone will go away once there are more people who are vaccinated, once there are more people who are really accepting of the precautions that we need to take, because now we're here over a year and have a better understanding. And I hope that the just extreme feelings of loneliness will not continue to endure.
Well, thank you so much, Dr. Harrison. I feel like for this first 20 minutes, you've given our viewers so many actionable tips, a lot of, great advice in terms of how to advocate for their health when it comes to finding a physician, dealing with the insurance company, just dealing with anybody that they're going to come in contact with. And so we're going to bring you on later to do a Q&A, but now I want to get more into the anxiety portion of today's conversation. We're going to talk to Dr. Angela Neal Barnett, who is a national award-winning psychologist, professor, and leading expert on anxiety disorders among Black Americans. She directs the program for research on anxiety disorders among African Americans at Kent State University. Her current work focuses on sister circles for anxiety across the lifespan and the role of race and stress in Black infant mortality. She's the architect and developer of the Build Your Own Theme Song app, and that assists middle school Black girls in reducing anxiety, and is also the author of Soothe Your Nerves, the Black Woman's Guide to Understanding and Overcoming Anxiety, Panic, and Fear. She's an international workshop presenter and speaker, and her work bridges the gap between academia and the real world. Her work has been featured on CNN, NBC, NPR, PBS, BT, the Oprah Magazine, Essence, the New York Times, and now she's joining us here on Jump In with Jumi. Please help me in welcoming Dr. Angela Neal Barnett.
Hi, Jumi. How are you?
Neal Barnett, how are you?
I am good. It's been a busy day, but I'm so glad to be here on Jump In.
Well, thank you for joining us. I'm so happy that you're here. I know our viewers are in for a treat with you because you are the anxiety expert helping people in our community. So thank you again so much for joining. And again, I just want to jump right into it. Early in the show, I posed the question of, do people think that anxiety is what did I say? I said, is anxiety all anxiety bad anxiety? Or do you think some level of anxiety is actually healthy? So can we start there? Is all anxiety bad anxiety?
Okay, so Jumi, I have to ask you to ask me the question again, because apparently people are watching the show and I'm getting all these calls and texts that you're on Jump In. So
that's good. I'm glad to hear that. All right. So the question again.
Ask me again, because I think I might have misheard the question.
Okay. So the question again is all anxiety bad anxiety, or is there healthy levels of anxiety?
So there are all anxiety is not bad anxiety, but we have to first make sure we understand what we're talking about when we say anxiety, because anxiety is this perception of a future threat. So we don't know what it is or where it is or when it's going to happen. We just know it's out there. Okay. So, and because we know it's out there, then that puts us on a state of alert.
Mm.
Good anxiety is we're just at this moderate state of alert. So I'm going to be on Jump In with Jumi. So I might have a little anxiety about that. Will I say the right thing? Will people hear me? Will I say something wrong? But that then makes me more committed to doing my best job on your show. Okay, so that's good anxiety.
Okay.
Bad anxiety, which puts us in the state of highest alert, which psychologists who like big words call hypervigilance, then I'm going to jump in and do it. I can't do it. Oh my God. Oh my God. And then I might start to sweat. I might start having trouble breathing. I might call your producer and say, I can't do it. I might have all these thoughts running through my head. I might think I'm going crazy. I might think I'm going to die.
Mm.
So what's happened is this bad anxiety has manifested itself in what is known as panic attacks. So I've had a panic attack about being on Jump In.
Mm-hmm. So let's talk about some of the root causes of anxiety, especially in the Black community. What are some of these? What causes it?
Okay, so one of the causes of anxiety is stigma. Okay, and the reason I say that is because when we look at people with anxiety, we find that their mother had anxiety, their grandmother had anxiety, their great-grandmother had anxiety, and so they don't talk about it.
Mm.
And so what then happens is, because they didn't talk about it, we don't know what is happening to us. And so we suffer in silence, and we get this transmission, this intergenerational transmission, which is also because our families might have a predisposition to this. We're not talking about it. Our families have a predisposition towards anxiety, and we've kind of played it off as, well, this is just the way it is. It's just some idiosyncrasy, and we'll be okay. Or we've kind of unknowingly supported the person in being anxious. Another form of it, and another cause of anxiety is stress. And I know Dr. Danny talked about stress and depression. But it's really important to understand that anxiety and depression are cousins.
Mm-hmm. Yeah, so, I want to hear about this. Like, I want to know, why is it that anxiety and depression, are so often co-occurring?
They co-occur because they're cousins, and what that's why they.
But why is
that's why they co-occur. But I want to get so let me say, the reason they co-occur is because of some of the reasons that we have anxiety in the Black community, and that's stress, and that's because of stress. And I don't know if Dr. Danny talked about the stress axis. Did you talk about that?
No, not yet.
Okay. So there's something called the stress axis, which is the HPA axis, which stands for the hypothalamus, the pituitary gland, and the adrenal glands. So what happens is stress, anxiety, depression start in the brain. So stress starts in the brain. What happens is that the hypothalamus, which is the thermostat of the brain, recognizes that we are stressed, and it signals to the pituitary gland, which sits at the back of the brain, to start secreting hormones. And the pituitary gland says to the adrenal glands, which sit below the kidneys, to start secreting cortisol. Mm-hmm. So when it starts secreting cortisol, the cortisol goes up, which is the stress hormone. But what happens is for Black Americans, in which depression is higher than for white Americans, that there's so many stressors, and then there's that chronic stressor of racism in all its forms, that it keeps the cortisol high. And when cortisol is high, we're looking at being at higher risk for depression. But it can only stay high for so long, and then it will just go down, and that's called blunted. Okay. And blunted cortisol places you at highest risk for anxiety and for trauma, and that's why they co-occur. So I'll give you a better example, because I know some of your listeners' eyes glazed over because I was psychological.
I know, I feel like they're following you. They're following you. Keep
I'm going to give you sitting on my deck.
Okay. I love your examples, by the way. Like keep bringing them for me. I love them.
Here's the example. It's like what happened when my daughter turned 16. Okay. I threw her the keys to the SUV, and I went down to the dealership and bought myself a grown woman's car.
Okay. What was that car? Hold on.
What that car that doesn't have animals, sports equipment, dance or instruments. So, okay. I drove it off the lot, popped the top, okay, and I started down Interstate 77 going 77 miles per hour. At the 78th mile, the car started making noises. At the 79th mile, steam started coming out the hood. And at the 80th mile, the car just stopped. Okay. It wouldn't go any further because I had burned out the engine. And that's what happens. The cortisol, high. So I'm speeding down. And then what happens is it burns out. And then, so the depression, and then it burns out. And even when I need it, I can't get it to go up. And so that creates the anxiety in our bodies.
So what suggestions do you have for people that are feeling stressed, that are feeling anxious? Like, what can we do today, like on a regular basis, to reduce these feelings?
First, we have to call it what it is.
Yes, help us name it, Dr. Neil Barnett. Help us name it.
Folks say she got bad nerves. He's got issues. No,
call it what it is.
Anxious. Okay. And it's also important to understand that anxiety is not crazy. It is just anxiety.
Thank you.
That's the first thing. Call it what it is. Okay. Second, ask for help. Okay. And Dr. Danny talked about the ways you can ask for help. For anxiety, it's really important because particularly Black females experience anxiety differently.
Yeah.
So it is, it lasts longer, so it's more chronic. And the symptoms are worse. The symptoms are more intense.
What are the symptoms?
Well, it depends on what kind of anxiety we are looking at.
Okay.
We describe panic attacks, which is for some people, all of a sudden, out of the blue, for no reason at all, they just get really, really anxious and scared. For other people, it's the situation. Okay, so the situation being on jump in creates this anxiety for me. And that's a form of anxiety called social anxiety. Okay. So social anxiety is about what must other people think.
So before you go on, I do want to touch on that real quick because I heard that social anxiety takes years to diagnose.
Yes. Yeah, well, because people don't understand it in Black folks.
Okay,
that's why it takes years to diagnose. And again, remember that Black folks' anxiety is more chronic. And remember, we're not talking about it. So we have it for longer periods of time before anybody diagnoses it. And then there are things that traditional white psychology, white psychiatry doesn't talk about that affects Black folks, which are things like being an only. So being the only one in your organization, being the only one in your school, being the only one in AP classes, that can create social anxiety because of the sense that I'm not only representing myself, I'm also representing the race, yes. And then the acting white accusation.
Dr. Neil Barnett coming through with these things. Okay, I'm listening.
So again, do you see this? We're not teaching that in, if you're not in my developmental psychopathology course, we're not teaching that in understanding in understanding social anxiety, and so the acting white accusation is a clear trigger for social anxiety. It's important to understand that social anxiety is not what must other people think in a negative fashion, but also what must other people think in a positive fashion.
Okay. So I have a question about this. You've mentioned a bunch of different, acting white, being the only. What about Superwoman syndrome?
What syndrome? I'm sorry.
Superwoman syndrome, the syndrome of as Black women, we can do anything and everything. Let's talk about that.
Yeah, Superwoman, a strong Black woman. The strong Black woman syndrome has sent many a Black woman to an early grave. And it certainly plays a role in anxiety. Again, even if I'm feeling this way, even if I'm having this anxiety, I can't let anybody know, because the belief is that you have to be a strong Black woman. And to be a Black woman or a Black male and to be weak is an oxymoron. So, yes, and again, and particularly in these dual pandemic times, this strong Black woman, this strong super hero motif, stereotype is preventing us from seeking help.
So how do we get more comfortable, in addition to what you said and naming the fact that it is anxiety, it is social anxiety, it is a panic attack, how do we get more comfortable in seeking help, and how do we find the right people to help us? Because not everybody's right. Same way I asked Dr. Danny about, finding a psychiatrist, how do we find a therapist who can help us work through these situations, who understands our perspective, because there's so many different elements that go into why we're feeling anxious.
Okay, so how we get more comfortable is talking about it. We talk about it in our churches, in our faith-based institutions. My faith-based institution has a wellness team, and we do, every quarter, we do a mental health Sunday. So, so that the sermon is on mental health, and then there's a panel of those of us who are on the team talking about mental health. We go around in communities, in schools, we're talking about it. At the urban leagues, we're talking about it. So we're having this community conversation about mental health. So people are going to listen to us, and then they have to find a therapist. So first of all, if you don't have any money, no insurance for a therapist, it's okay. Because many people, if you are in a city or a town where there is a college or university that trains people to be therapists, they have a clinic. And the clinic will see you for a sliding scale or for free. therapists are graduate students, but they are being supervised by people like me,
Right.
licensed PhD psychologists. Okay, so that's the first thing. You want somebody who is culturally competent. Okay, Dr. Danny spoke very eloquently. There are not a lot of us around. And so you need to, if you can't find somebody who looks like Dr. Danny or I, then you want to find somebody who is culturally competent. And you need to ask them the following questions.
All right, y'all, listen up. She's going to give us questions to ask. All right. What is the question?
Have you ever seen anybody who looked like me? Okay. Have you ever seen anybody black? Okay. I don't care what they say. If they say no, then you go to the next. Okay. That's just the long and the short of it. And I tell people it's like this, okay? Would you go to a hairdresser who didn't know how to do black hair?
Wow.
So and that's what you ask. Can you do black hair? Well, you were trained to do all kinds of hair. I'm not, no, you don't know what you're doing, and I'm gonna come out looking like who knows what.
Right.
Okay? You take the same care with choosing a therapist as you take with your choosing a barber or a hairdresser.
That's true.
That's the kind of care you want to take. So you ask them that, because nobody wants to be in therapy with someone who you have to explain what it means to be black to.
Yes.
That's awful. Okay. The second thing you want to know is, what is your approach to treating anxiety? Okay? All right. And what you should hear their answer should be cognitive behavioral therapy, or CBT. I take a CBT approach to treating anxiety because that is the gold standard. Okay.
Mm-hmm.
I am a psychologist, so I don't prescribe medication. But what we do know is that many people in practice have a work in partnership with a psychiatrist. And for anxiety, medication takes the edge off. Okay, but the gold standard is CBT. And if you're prescribed medication, then you want that in conjunction with CBT. Okay. That medication alone is not going to help you learn to manage the anxiety, or learn what to do when you start to feel anxious. So in combination or CBT.
Okay. So find somebody. Have they ever worked with someone that looks like me? And what is your approach? Two very important questions to ask when you're looking for a therapist. This has been such incredible information. I'm Dr. Neil Barnett. And so now I want to open the floor, bring up Dr. Harrison, and, answer some of the questions that some of the viewers have been putting in the chat so that we can have a really engaging conversation for these last few minutes about, how to really, truly manage our anxiety and depression, in addition to everything that you've already told us. So let me bring on Dr. Danny right now. So once again, both of you all, thank you so much for what you've been telling us today. And I do want to start with a question from Faithful Carter. And her question is, how are different evidence or signs of depression exhibited in males versus females? How is it presented in both? Dr. Harrison, did you want to take that?
Oh, is this from me? Okay.
Yeah.
Well, so I think the most significant one that we see commonly is sometimes with irritability and anger. Black males in particular are where we see depression and anxiety as well exhibited as irritability or anger. Sometimes my patients will just say, I'm not sad, I'm just mad. And if you just take that at face value, you're like, okay, well, you're just a mad Black man. Okay, next. However, if we don't have the cultural humility or the push to go further, you might learn that they say, well, I'm mad because. Like, why are you mad? I'm mad because I'm not where I wanted to be in life. I'm not able to provide these things. I'm a Black man who's going outside in the time where people think that it's okay to take my life for jogging down the street, anything like that. So I think we see that commonly as a difference in Black males' presentation with depression. And again, for Black women, as I said, a lot of times we see somatic complaints, which are, again, body complaints of saying, like, I just feel tired. I'm not feeling like myself. I don't feel like doing this, something like that, that's usually involving fatigue or a body feeling or sensation. So that's something that's common, both with Black men and women, but we see that more commonly than other groups. But also we see it in Latinx populations as well. As I said, we haven't always had the privilege of being able to say that I'm going through something, right? So there's been a stigma, and this stigma is rooted in, spoiler alert, enslavement and colonization, and where you weren't allowed to talk about your feelings. And if you did try to express your feelings or be someone, you would be punished. Anything from institutionalization to death. So that is really the root, structural, systemic, institutional racism for the stigma that we have really adopted as a culture to survive. So hopefully that was a long answer to your question.
No, that was a fabulous answer. Thank you so much. We have another question from Sharice Kennedy, and it's a very interesting question. Does a past history of PTSD automatically indicate someone will be diagnosed with depression or anxiety later on?
Sharice Kennedy is my sister. Shout out to my sister.
Yeah, who wants to take this one?
Okay, so PTSD is, which post-traumatic stress disorder, is a very complex disorder, and that sometimes at least suicidality is mixed in there with that. But suicidality is not necessarily a sign of depression. So because it is so complex, the answer to that is it really does depend on the individual.
Okay. That's important. Yeah, no, go ahead.
I'll agree and just say that, just like Dr. Neil Burnett said, that anxiety and depression are cousins, because we see similar presentations and complaints or symptoms between anxiety and depression. Like, we see difficulty concentrating. We see issues with sleep. We see issues with guilt in both of those. The same thing happens with PTSD, because there are, there's even complex PTSD where you see symptoms of anxiety, you see symptoms of depression, you see symptoms of trauma all in one. So again, it does depend on the patient. It does depend on you and what your experience is. Luckily, though, if we do attack this and treat it, just because you are diagnosed with trauma or you have had PTSD in the past, it doesn't mean that you necessarily are going to go forward and be diagnosed with anxiety and depression, which brings us back to our topic at hand today, talking about it so that we can get these things addressed.
Yes. So important that we address it and that we know, that there's ways to heal from it. Yes, we have, we've gone through a lot. I know there's another question. It's like, how should we be reacting to racism and reacting to these things that have caused the anxiety and depression? I mean, what do you tell your patients and clients and people you come across that are asking that kind of question of how should I react?
Yeah. Okay. Again, racism on its good days is a chronic stressor. And it's bad days, and for the past year, it's been a bad day for racism. It is trauma, and so there are different ways to react to it. There are times when you just have to call it out. And there are times when you have to just take a step back or take they say in the community, take a breath that allows you to begin to think about okay, what is the best response to this.
Mm-hmm.
Other piece that people don't talk about is that it is the burden, given what's happening in this dual pandemic, that there's this burden that is placed on Black men and women to somehow save the company or save the organization or tell everyone what to do in terms of racism. And that then also triggers anxiety and in some cases depression. So you have to each situation may not result in the same response. However, whatever you do, once you've done it, it is important that you have other people for support, other people who you can go and say, girl, you will not believe what that Karen said to me today. Okay? Because, and the importance of that is because if you don't, you keep it inside, you internalize it, and that increases your risk for depression and anxiety. So once it happens, once you choose your response, you need to have a support group, an accountability partner where you can talk about what has happened, because that is critical to maintaining your mental health.
Whew. I don't know about y'all watching, but like, I feel like this has been a therapy session in itself, having this conversation. Like, I really feel a burden has been lifted off my chest, just hearing all of these tips that you have provided from both the psychology and research perspective and the clinical perspective. And I really do think that our viewers are gaining that right now. There is a question from Catherine Torrance, and her question is, what about anxiety that you can't assess the root of it? Where is it coming from? That's a great question.
And that just might be coming, anxiety, the roots of anxiety are biopsychosocial. And so that one may just have this predisposition to be anxious. It's not really about where is it coming from. It's about recognizing that it's coming. And if I know where that it's coming, what is it that I do? Okay. Spent a lot of time trying to figure out why I am anxious. And that is not the question.
And I would just add that sometimes it's figuring out the triggers. What are the triggers for your anxiety? So that is something that you can really look into with therapy, as I said. So that's why my answer to all treatment is usually therapy plus medication, or even sometimes therapy alone, figuring out what is triggering this. So if you do figure out that, it's something, as Dr. Neil Burnett said, is bio, like your grandmother had anxiety, your father had anxiety, your aunts, your mother had anxiety, they didn't talk about it. If you figure out what were their maladaptive behaviors, which we're probably not talking about it and keeping it in, then you can use that as an approach to make things different for you. So you can then talk about it like, this really makes me worried, like really having to drive in Washington, D.C. traffic. I don't do that. I take the train. But previously, I learned that driving the track, like, it makes me anxious. And even if it wasn't something that I could identify automatically, I knew that just like as around the time for me to go home, like I start worrying about this. I'm worried about this. When I get home, I'm stressed. I'm going off in the house. And really, like, what is the trigger? What am I worrying about? Am I worrying about there's going to be an accident? Am I worried about what's going to be happening when I get home? Like, just really understand what are the triggers so you can try to mitigate them or modify them or decrease them as much as possible.
And how important is it for us to be patient with ourselves and kind with ourselves as we are identifying what we're feeling and getting the help that we need and wanting to see improvement?
Allow yourself all the grace. That is very important. If you learn nothing else in 2020, allow yourself some grace. I always talk about, and I need to practice more, the importance of saying no to some things. Like saying no to others is saying yes to yourself. And as our Auntie Maxine said, reclaiming your time and what you need for yourself. So it's incredibly important that you allow yourself some grace. If you can't do every single thing and be that super Black woman, you know what? It's going to be okay. Because if something happens to you, your job is going to send some flowers, and then they're going to put a posting right up there for your jobs to be replaced. So allow yourself some grace, and make sure that others allow you some grace as well. Say, you know what? I can't get this done this time. I can get it done in 2 weeks though. Does that work for you?
Yeah.
If not, okay. I'll go on to the next opportunity.
Right. Very true. Thank you. What about you, Dr. Neil Barnett?
I agree. In the words of Aretha Franklin, grace will lead you home.
Hello.
And grace leads you to healing.
I love that. Grace leads you to healing. Well, before we sign off today, what are some resources that you want to leave with our viewers today as they continue to learn more about anxiety and depression and how to find a practitioner that works best for them?
I always recommend the Anxiety and Depression Association of America. That's ADAA.org, ADAA.org. They have a Find a Therapist section. They have a number of blogs on anxiety as it relates to BIPOC and to Black Americans. So that's excellent. The other one is abct.org, which is the Association of Behavioral and Cognitive Therapies. Again, same way to find a culturally competent therapist. And because, as I said, the gold standard for treatment is cognitive behavioral therapy. So you'll get insight into that. And then, as always, the Association of Black Psychologists. And again, they have a referral list so that you can, if there is a Black therapist in your area, you can find him or her.
And I'll just add to that some others that you can look on into. I mentioned like psychology today. So that's a way that you can actually see people and see what they specialize in. I stand by that one. Also, Therapy for Black Girls, a good resource, also has a podcast. Melanin and Mental Health is another one. InnoPsych is another one that can help connect you to therapists and psychologists who are interested in your culture and how things impact you, and you don't have to teach them about the importance for that. The Black Mental Health Alliance is another one that you can check. It's Baltimore based, and working with them, I have worked through the Black Psychiatrists of America, another resource, and the APA Black Caucus, which I'm the president of. We work to make a needing updated list, which has a directory of Black psychiatrists across the country that you can look through and see. Now, we haven't updated it in some time, so we need to add people, delete people who aren't accepting patients. And then I also have a platform called @BlackPsychiatry, which is on Instagram, which is on YouTube, and Facebook. And you can watch videos where I am lucky enough to somehow get experts like Jumi brought in today, who are Black across the board providing mental health services. The last one we talked about Black women in mental health, and it's the best place that you can get some psychiatry, some therapy, all for free, 99. So for our community as a collective. So I would also check out that if you can. So that's @BlackPsychiatry. And of course, I'm going to just reiterate what we heard earlier, that university programs. Universities, look for universities in your city, in your state, in your county, where they have many Black residents, many Black psychologists who are in training and are willing to really learn to work to further their careers to help people who look like us in our communities.
Wow. Listen, y'all have been so amazing today. I know our viewers have found a wealth of information in this conversation. I myself have found a wealth of information in this conversation, and I feel very empowered and educated. And I really do hope the same for everybody watching today. You know, it's so important that we take control of our health. We advocate for our health. We know how to put a name to what we're feeling and have these conversations, like Dr. Neil Barnett was saying, with our sisters, with our friends, with our family members, to make sure that we don't continue to suffer in silence. Like they're saying, have grace on yourself, be okay with saying no, don't take on a whole bunch of things, but know that there's people out there that are willing to support you. So this has been, this week's episode of Jumping with Jumi. Please make sure to like and share this. The information in this, I want everybody in your lives to get it. So please make sure to share it, because there are people that definitely need to hear it. I'm Jumi. This has been this week's episode, and I will see you all next week, same time and same place. Thank you again, Dr. Neil Barnett and Dr. Harrison. I'll see y'all again soon. Bye.
Bye-bye.